Там больше ссылки. Надо бывает. Да, я вам могу сводную таблицу, где еще будет появляться. Good afternoon, dear students. Please invite me in the chat. Now will be lecture number 4 on the topic medical rehabilitation technologies using exercise and massage. I am Professor Bobrik Yuri Valerich. Please, if you hearing me and have normal sound, can see normally illustration in the screen of computer, please tell me in the chat. Write down, okay, I can see 2 students. Write down me in the chat. Так. Tell me please in the chat about the quality of sound and video. Okay, dear students, please hurry up. Lecture start, but only 3 students I can see take part in the lecture. Dear students, please write down about yourself in the chat. Who is present? Please hurry up. Good afternoon, dear students. Good afternoon. Please connect to our online lectures on the topic medical rehabilitation technologies using exercise and massage. Okay, I can see many students connect, but not all. Please, all students who can see me, see the pictures of lecture and can hearing me, please connect and we write down about yourself in the chat. It's you fixates your presence in the lecture. Okay. Purpose of the lecture: to generate a student representation about medical rehabilitation technology using exercise and massage. Question for discussion: physical exercise classification, clinical and physiological substantiation and mechanism of therapeutical use of physical exercise, means and forms of exercise therapy, motor modes, clinical and physiological substantiation and mechanism of therapeutical use of massage, classification of massage technique and type of massage, psychomotor correction. Please connect to the lecture as soon as possible. We are starting lecture. Dear students, did you remember what is medical physical culture? We discussed this on the second lecture. The physical culture is the component of general culture of as a society representing the whole complex of material and cultural wealth created by mankind during public historical development. Components of physical culture are the big sport, health improvement physical training, and medical physical culture. And another name, synonyms you can find, it's exercise therapy. Exercise is the stressor which upsets the consistency of our internal environment. Therapy means any methods or procedure to alleviate any pathological condition affected by injury, disease, or disorder. Pathological conditional is a conditional different form of normal conditional. Exercise therapy, when exercise is used for diagnostic, treatment, rehabilitation, and aftercare purpose, is termed as exercise therapy. Medical physical culture and exercise therapy is organically part of the general physical culture. It's nature biological methods of the active treatment, because patients involved in the treatment actively, in difference from passive treatment, when we use, for example, drugs and other methods, surgical operation. Method of non-specific treatment. In this situation, we can treat many types of disease. Its methods of training treatment, strict dosage need. Methods of functional treatment, improve functional condition of patient. Methods of the prophylactic treatment, using of exercise therapy, medical physical culture can use for primary prevention of disease, and also for secondary prevention of disease when person have chronic disease, but when you use physical exercise, therapeutical exercise can prevent exacerbation, complication of chronic disease. And also exercise therapy, medical physical culture, it's method of the rehabilitation treatment, which help more fast recovery person after trauma of disease. What is means of medical physical culture exercise, medical physical culture? No, it can divide on the two types. It's main and additional. Main types are it's physical exercise, regimen of movement, activity, massage, and nature factors. Additional means is ergotherapy, nazvane occupational therapy. In the medical physical culture, exercise therapy, all exercise can classificate on the some types. Gymnastic exercise, ideomotor exercise, sports applied exercise, and games. How about ideomotor exercise? It's very interesting phenomena which widely used as in sports medicine and also in the rehabilitation medicine and physical treatment. Ideomotor exercise, it's exercise connect with formate image of movements, idea of movements in the cerebral cortex of patient. When patient have imagination of any movement, for example, raise hand, but person cannot have this type of action. Why? Because, for example, have paralysis, plagia. But if person have imagination of movements, in the muscles, in the nerves of extremity appear same changes how with during movements, improve blood circulation, improve nerve conduction, improve trophic process. It can use for rehabilitation and treatment. How about sports applied exercise? As usually type of exercise which similar with kind of sport. No, what for example, swimming, running, jogging use that very widely, cycling, boating, ski, sky, maybe weightlifting, or maybe carry lifting, carry weight, sorry, um, archery, and satyr. How about games? All games in the rehabilitation treatment in the medical physical culture divide on the three types. It's games on the place, for example, chess. Small active games, for example, golf or maybe snookers, and active games. It's table tennis, for example, football, basketball, volleyball, etc. About gymnastic exercise, divide on the two large group. It's active exercise when movements do voluntary movements do patient, or passive exercise when movements in the extremity, in the trunk of patient do physiotherapeutist or maybe a nurse or maybe a relativist of a patient. It's variant of passive exercise. Also of physical exercise which use in the exercise therapy divide depend from a muscle group which involve in the physical activity. Divide on the exercise for small muscles group. For example, it's fingers on the lower extremities, upper extremities, and facial muscles. Next group is exercise for middle muscle groups. It's forearm, legs, and muscles of neck. You can see now in the illustration the variant of exercise for middle muscle group, exercise for muscle of neck. Also, there are group exercise for large muscle groups. As usually it's trunk muscles, it's biceps, triceps, quadriceps, gluteus, and etc. Okay, there are also classification of exercise depend from goal, depend from effect of training when use this exercise. One of them it's stretching exercise to improve the range of motion at a given articulation, but altering the extensibility of the muscular tendinous units that produce the movements. You can see on the picture some variants of stretching exercise. They improve stretch all stretching exercise divide on the some types. It's ballistic stretching, static stretching, PNF stretching, passive stretching, and active stretching. Ballistic stretching requires repetitive contractions of the agonist muscles to produce quick stretches of the antagonist muscles. Simulate sport-specific skills functional. Static stretching. Passive or active stretching are given antagonist muscles by placing it in a maximal positions of stretch and hold it for an extended time from 3 seconds to 60 seconds. 3 to the 4 times. PNF stretching. Muscles energy release technique, which include contract, relax, relax, contract. Commonly used with athletes and individuals with limited range of motion or patients with limited range of motion. Passive resistive stretching technique. Another name, passive stretching training. Passive stretching is a type of stretching in which you stay in one position for a set time. You're able to relax body while a partner, accessory or prop intensifies the stretch by putting external pressure on your body. Can also use the floor or a wall. During static stretching, move your patient body as deep as it will go into the stretch. Once patient you've reached your limited or place of tension, you hold this position for up to 1 minute. Doing this allows your body to relax into the posture. Stretching is an important part of being active. Its benefits enhance muscle function, allowing patients to move with greater ease and comfort throughout daily and athletic activities. Regular stretching reduces patient chance to injury, enhance flexibility, and increase range of motion. Patients feel better then it has less in the muscle tension, soreness, and tightness that often accompany exercise. Stretching can help improve flexibility and range of motion joints. Improve flexibility can improve performance in physical activities, decrease risk of injuries, help joints move through the very full range of motion, enable muscles to work most effectively. When should do in the exercise session of stretching exercise during exercise therapy? As usually, stretching exercise should do in the final part of exercise session. If you remember, when we discussed medical rehabilitation, I said during exercise therapy there are three stage of exercise session. First, it's introductory, another name warm up. Second, it's base, main part, and third last part, it's final part of the maximum heartbeat, maximum respiration rate, maximum temperature of body is in the end of basic part. In this period, temperature of muscles, tendons, and ligaments is optimal for provide stretching. Minimum risk of damage, rupture of ligaments, muscles, or tendons. Why? Because there are maximum blood circulation in the musculoskeletal system. In result, this more elasticity with tissues and the maximum effect of stretching exercise. Please remember about this. Also very good before stretching, use massage. We will discuss some bit later how it's possible. Okay, next types of exercise, gymnastic exercise. Now we discussed, dear students. It's classification of exercise depend from type of muscle contraction. All exercise divide on the isometric exercise, isotonic exercise, and isokinetic exercise. Isometric exercise. It's static exercise with muscle contraction but no movement of the load, resulting in no change in the total length of muscles. You can see on the illustration the people try push wall. Wall not change position, but tension in the muscles increase. It's training effect. Why have name isometric? If you remember from Latin language, iso it's constant. The metros is length. Length is constant, no change, but tension in the muscles change. It's isometric exercise. How about isotonic exercise? During isotonic exercise, the tonus of muscles is constant, same, but length of muscles change. Note now you can see a variant of isotonic exercise. It's dynamic exercise with a constant load but uncontrolled speed of movement. Isokinetic exercise. Exercise with movement controlled so that it occurs throughout a range at a constant angular velocity as the muscle shorten or lengthen, but the load may be variable. On the picture you also can see a variant of isokinetic training. Okay, strengthening exercise. It's as usually a resistant training. Is any exercise that causes the muscles to contract against an external resistance with the expectation of increase in strength, tone, mass, and or endurance. The external resistance can be dumbbells, rubber exercise, tubing. Also can use own body weight, bricks, boards of water, or any other object that causes the muscle to contract. On the picture you can see types of resistance strengthening exercise which increase strength. What isometric exercise? It's one of variant this exercise. Exercise with dumbbell, isotonic exercise, also one on kind this resistant training. Here in this picture you also can see the example of resistant training. Use weightlifting. Okay, next type, it's balance and neuromuscular exercise, or exercise improve balance and coordination. This form of exercise helps patient nerves and muscles to communicate better. They are used to help prevent falls in the elderly or help improve knee stability in patient and athlete, among other things. An injury disrupts the communication between patient muscles and nerve, limiting patient body from appropriately responding. This type of training recommended for persons with balance and coordination disturbances. You can see some variants. Equipment, exercise with equipment for improve balance and coordination. The exercise goes to increase muscle strength, to increase muscle endurance, to increase speed of muscle contraction, to improve cardiovascular fitness, to improve flexibility, to improve control and coordination. Now, about strength, understand its ability of the muscle to generate force, again, some resistance, but about endurance. What is endurance? Its ability to perform repetitive muscles contraction against some resistance an extended period of time. Power, large amount of force generated quickly, includes elements of strength and speed. Some exercise, close kinetic chain exercise, can help in the improve these parameters, thus strength, endurance, and power. Suffer and produce stresses and forces that potentially less of the threat of healing structures. E.g. minus squats 0 to 40 degree, leg press, stairs climbing, lateral step up, push-ups, chin-ups, handstands, weight shifting exercise using medicine ball. Next type of exercise, which have name exercise, cardiovascular exercise or endurance exercise for increased endurance, or another name aerobic exercise, and another name this is exercise it's cyclic exercise. Imposes sub-maximum energy requirement. What is it consistent throughout the training session? Aerobic, rhythmic, walking, jogging, rowing, cycling, swimming, all many sports applied exercise used for improve endurance of patient during rehabilitation different types of disease, cardiorespiratory system, etc. Uses a series of exercise stations that consist of various combinations of weight training, flexibility, calisthenics, brief aerobic exercise. You can see some variants using this cardiovascular training, endurance training. It's circuit training followed by relief stations, incorporates work intervals. Fartlek training, types of cross-country running, means speed play, similar to interval training. Also, there are plyometric exercise. Exercise encompasses the rapid stretching of muscle eccentrically, followed by rapid concentric contractions. The greater the stretch before concentric contractions, the greater the resistance the muscles can overcome. Emphasis the speed of the eccentric phase of rate of stretch is more critically than the magnitude of the stretch. Plyometric exercise control in dynamic movements. Put more stress in the musculoskeletal system, must be technically correct and specific to the one's age, activity, and physical and skills left. Dear students, therapeutical exercise used for prophylactic disease, treatment, patients, and rehabilitation during long time. Historical medicine said exercise therapy use 5000 before Christ was find the artifact it was textbook, um, textbook on the papyrus. It's China's textbook, where was explanation how should do exercise for treatment different disease, and uh, gave complex prophylactic exercise. Dear students, and now very widely exercise used for treatment, rehabilitation patient, and for prophylactic disease. Why? What the mechanism of actions, therapeutical, prophylactic action, rehabilitation action exercise on organism? There are scientific explanation in the basis of fundamental of scientific explanation, therapeutical effect, therapeutical effect of exercise lie down the theory of motor visceral reflexes, which was discovered and used in the practice in the 20th century. All positive therapeutical effect initiate in result of activation motor visceral reflexes. When person do any movements or change tonus of muscle, like how for during isotonic exercise, what's happened? Activate proprioceptors in the bone, muscles, ligaments, and joints. These nerve impulses pass to the central nervous system, and in the nerve centers send to the autonomic nerve centers, from somatic centers to the autonomic nerve centers, and activate parasympathetic activity in the visceral organs. If you remember from normal physiology or maybe from neurology, segmental innervation of body, what each segments connect with appropriate proper organs and systems. In result, this exercise, for example, in the upper extremity, activate blood circulation, lymph circulation, nutrition, trophic process in the organs of thoracic cavity. Exercise for low extremities, activate blood circulation, lymph circulation, and trophic process in the organ's pelvic bottom. Exercise of connect with contractions of body muscles, for example, abdominal press, back muscles, activate blood circulation, lymph circulation in the organs of abdominal cavity, in the liver, large intestinal, small intestinal, etc. Its principle, fundamental principle, lay down in the explanation therapeutical effect of exercise therapy, physical exercise. Okay, but in result activation, nerve system also activate humoral systems. and response on the physical exercise in the human body have neurohumoral character. In result this, we can observe some therapeutical effect of physical exercise. First, it's stimulating action. Exercise therapy is biological stimulator of morphofunctional structures and protective adaptive reactions of an organism in development of adaptive reactions of the patient on physical loading. The big role belongs as adaptation trophic function of sympathetic and parasympathetic nervous system as to regulator homeostatic mechanism of a constancy of internal environment. Traffic actions, which consequence is normalization of a metabolism, improvement of plastic processes, and regenerations of tissue damage. Do you remember I said about improved lymph circulation, blood circulation? In result, this more oxygen come to the tissues, that improve metabolism, more nutrition substance pass to the tissue. It stimulate regenerative process, the result of any trauma, or also stimulate immune reactions, more blood, more lymph circulation, better response on the infection alteration, and better function of immune system, less risk different infection disease, autoimmune disease, and also more fast recovery after infection and autoimmune disease. Exercise therapy exceeds bioenergetic, activates oxidative phosphorylation, glycolysis, fermentative activity, lipolysis, oxidation reduction process. Formations of compensations and disease disturbances of functions are compensated by adaptation of injury or other systems due to optimizations of regulator mechanism. It is a temporary of constant replacement of the broken function, dyspnea, tachycardia, and pneumonia. Exercise therapy develops compensation due to strengthening of respiratory muscles, increase in mobility of ribs, diaphragm, deep, rare breath. Short, it is more economic. Next therapeutical mechanism is normalization of function. Exercise therapy liquidates motor disturbances. However, recovery does not mean preservation of capacity for work. Therefore, exercise therapy during recovery restores the lost function with the help of special exercise, force of muscles, coordination of movements, etc. What is benefits of exercise? Dear students, there are benefits of exercise in the all organs and system of organism. But did you remember I said on previous lecture, it's possible only in the result of optimal physical training, the rational physical training. No, uh, there are many effects. No, on this illustration, you can see some of them. It's increase. What? How about cardiovascular system? Its antisclerotic effect, increase the high density lipoprotein, decrease in triglycerides, and lipoproteins of low and very low density. Also, increase the body ability to dissolve blood clots by increasing fibrinolytic activity. Did you remember? I said in result of physical activity produce more antithrombin 3 and heparin. In result, this decrease risk or stimulate more fast dissolve of blood clots, thrombosis. Helps in the reduced blood pressure. Why? Did you remember? During physical exercise produce too much carbon dioxide, nitric dioxide, lactate, pyruvate, and other. It's decreased tonus of blood vessels, and also activate parasympathetic nerve system in result of systematic training, and as a result decrease systemic blood pressure and prevent, and we can use exercise for treatment many cardiovascular disease. How about nerve system positive effects? The anti-depression effect, anxiolytic effect, improve cognitive function. Why? Because during physical exercise produce some substances, antidepressive effect, the endorphin, enkephalin, serotonin, dopamine concentration increase, and it have positive effect on the level of mood of patients. It's very interesting effect of exercise there. Better blood circulation in the brain, stimulate work of cerebral cortex cells, and the result is improved cognitive function, memory, attention, thinking, etc. It's scientific fact. Help the bones be stronger, inhibiting osteoporosis, mechanical influence which create during exercise, stimulate function of osteoblasts, and increase consumption from blood osteoblasts, calcium and phosphorus. Without this, it can use for treatment and prevention of osteoporosis. Using systematic exercise can use for treatment and for prophylactic diabetes mellitus and cancer. It's World Health Organization facts that persons who have systematic or physical training have in 20 times less risk diabetes mellitus second types and cancer disease. And these benefits I can continue explain you during long time. How about concepts in exercise? It's adaptation. Cardiovascular system and muscles adapt to the training stimulus over time. Significant change noted in 10-12 weeks. The higher the initial level of fitness, the greater the intensity of exercise needed to elicit a significant change. We must remember about this before start physical training. All effect of exercise can divide on the two on the time two types. It's acute or immediately effects and chronic adaptive or training effects. On the location, it can be local effect or systemic effects. How about acute effects? Start of exercise, increase heart rate, increase cardiac output, increase in blood pressure, increase in venous return, increase in arteriovenous oxygen difference. Acute effects, starts of exercise, increase heart rate, increase cardiac output. Systemic effect. In isotonic exercise, decrease peripheral vascular resistance, increase in muscle blood flow. For isometric exercise, decrease in local blood flow to the contracting muscles, increase blood pressure. Why it's important to know this effect of different types of exercise we can use in the program rehabilitation. For example, we some bit late will discuss the peculiarities of rehabilitation patients with different disease. For example, isotonic exercise, which will be the best type of exercise for person with hypertension. But isometric exercise for this person will be contraindicated. And opposite, person with hypotonia, hypotension, using of isometric exercise will have treatment effect. As exercise continues in constant rate, steady state, heart rate, blood pressure, cardiac output at the end of exercise, initial rapid drop in heart rate, then slow return to normal. Decrease in blood pressure sudden if exercise is stopped abruptly. Respiratory effects. Respiratory rate increase 5 to 6 times in maximum exercise. Tidal volume increase 5 to 7 times. Hormonal effects. Decreased insulin production, increased glycogen production, increased catecholamine in intensive exercise, increase in growth adrenocorticotropic, TSH, adrenal and androgen hormones. Its acute effect. Systemic effects. Arm exercise and leg exercise. Higher systolic and diastolic blood pressure. Higher heart rate. Higher oxygen uptake. Exercise should use work for 40 to 60% lower than those used for leg in the order of their systemic effect. Local effects in the muscle being exerted. Increased oxygen extraction, increased oxygen consumption, increased carbon dioxide production and vasodilation. During isometric contraction, complete occlusion of blood flow, 70% of maximum voluntary contraction level, depletions of energy substrates. During isotonic exercise, slow twitch fibers first to lose glycogen, then followed by the fast twitch fibers. Which forms of exercise therapy, medical physical culture use for treatment and rehabilitation and prophylactic disease? Its, dear students, can be therapeutical gymnastic, mechanotherapy, apparatus therapy, hygienic gymnastic, terrain cure, dosed walking, walking flights of stairs, and hydrokinesiotherapy. Stairs climbing in another name, that walk flights of stairs. Monic hygienic gymnastic. It is a complex of the general developing exercise intended for normalization of process of stimulation and inhibition in cerebral cortex. Dear students, why this form of exercise therapy, medical physical culture have name hygienic gymnastic? Because, dear students, this form of medical physical culture can use all for prophylactic many disease and improve functional condition of organism. Can use patient, ill person, but can use healthy person for prevention disease. I recommend you do this using this form of exercise therapy every day. Why? Because after sleeping, it stimulates cerebral cortex activity, improve your mood. Also, improve blood circulation in different organs and systems. And result this, not need use different stimulators as caffeine, but it's guarantee good mood, activity, effective activity in all day. 15-20 minutes at morning time, gymnastics, it's very, very useful for health. Please remember about this and use this knowledge in your practice. And also it's improve effectiveness of educational. Many scientific investigation prove this. Please remember, dear students, about this. Okay, other therapeutical gymnastic, medical gymnastic. It's spanned by a group or individual methods in patients those conditions is very serious. Acquisitions of groups are carried out basically on nosologic principle. Duration of exercise makes from 10 to 15 minutes at the bed patient during strict bed regime. We will discuss this. What is it? For example, after acute disease or up to the 45-60 minutes in the period of recovering. Dosed walking. Its improving and training influence depends on the gone distance and rate of walking. So it's 60 to 8 meters in 1 minute. Steps 1 minute. Medium, it's from 90 to 110 steps in the 1 minute. And fast, 120 and more steps per minute. After acute disease, walking with gradual increase of distance every 1 to 3 days, fractional dose up to 3 to 5 kilometers in a day is appointed. The walking is a very good methods of exercise therapy, which used very widely in all world and give very good effect. Now, for this, use special equipment, pedometers. Very often these pedometers are present in a mobile phone, in the watch, smartwatch, and can help in the correct dosation of intensity physical exertion during walking. Also use dosed swimming. The principle in general is same. Okay, next is mechanotherapy. In exercise therapy, trainers of local and general action are applied. Trainers of local actions used for development of rigidity in joints of extremities and strengthening of the weak muscles in patients with disease and consequence of traumas of the locomotor system, in addition to active and passive physical exercise and use for these different equipment. Hydrokinesiotherapy. Physical exercise and swimming render training and hardening influence thanks to combinative influence on an organism of mechanical, temperature, and hydrostatic factors at temperature 25 to 20 C degree of Celsius is applied for treatment of disease of organs of blood circulation, respiration, metabolism problem, nervous system disease, traumas in the face of proof compensation and remission of chronic disease. Now you can see combination hydrokinesiotherapy with delphin therapy. In this situation, effect can be more. Delphin therapy is also one of variant of physiotherapy, hydrokinesiotherapy, physical treatment. Please remember about that. The temperature 34 to 36 degree of Celsius weakens muscles, reduce the spastic phenomena and a pain in the movements. Therefore, is appointed to the patients with purpose of development and mobility in joints of extremities, a spine, reduction of muscular rigidity and spastic paralysis and paresis. Now you can see some exercise which use during hydrokinesiotherapy. It's aquatic exercise. Okay, other forms, which forms of exercise therapy is stairs climbing, very widely used in the rehabilitation. Terrain cure, walking on the cross-country terrain. It's used as usually for rehabilitation patient with cardiorespiratory system disease. How about parameters of exercise during exercise therapy? No, it's mode of exercise. Can be aerobic or anaerobic exercise. Aerobic exercise, it's sport apply exercises with when person during exercise patient that consume too much oxygen. It's walking, running, cycling, swimming. Anaerobic exercise is usually it's isometric exercise or isotonic exercise with resistance. Should also moderate intensity of exercise, duration of exercise, and frequency of exercise. It's very important in providing individualization these parameters during recommendation of exercise. We discussed this topic during discussion diagnostic technologies in the sports medicine and medical rehabilitation. For this use, functional test or stress test. Did you remember previous lecture? For control effectiveness of exercise therapy, medical physical culture, as usually use control how change parameters of human body organism, functional activities, physical capacity, tolerance for physical exercise. You can see one of variant cards which fixate, registrate prescription for exercise activity and exercise therapy. Necessary remember about correct form component exercise. That it's pre-exercise warm up, pre-exercise stretching, exercise proper, post-exercise cool down, post-exercise stretching. Initial part of exercise therapy session, if you remember, I said have name warm up. What is purpose of warm up? To rise the general body temperature, to rise the deep muscle temperature, contract more forcefully and legs more quickly, to stretch collagenous tissue, to reduce muscle viscosity, improving the mechanical efficiency, to increase the speed of nerve impulses and augment on sensitivity of the nerve receptors, to improve the cardiovascular response to sudden exercise. It's the times of warm-up which can use during training. It's late in warm-up when the specific skills or an event are performed during the warm-up. Preferred if activity starts slowly and progresses into more intense activity. If unrelated warm-up, then movements performed are different from the actual skills of the activity or event. Preferred of immediate participation in the actual activity is required. Warm-ups. As usually 15 to 20 minutes. Intensity and duration should be individualized. Dear students, now we have conversation about um, recurring period of exercise therapy for person on the free movements regime. Enough to increase body temperature and perspire, not too intense to cause fatigue. Usually coupled with few minutes of high intensity exercise to result in better performance. The effect of warm-up lasts up to 45 minutes. The closer the warm-up to the event, the more beneficial it will be in terms of effective performance. Should begin to taper off 10 to 15 minutes prior to the training or competition event. Should end 5 minutes before the start of activity to allow recovery from fatigue. On this picture, dear students, you can see the graph which illustrate different period of exercise session. First period, where the minimum heart rate, pulse rate, its initial period, warm-up phase, and final period, cool-down phase. In the correct training, during warm-up phase, heart rate, respiration rate, body temperature should gradually increase and achieve the maximum in the maximum heart rate should be in the main base phase of physical training, aerobic phase. You can see that. You can see the parameters of heart rate during high intensity training zone, moderate intensity training zone, and low intensity training zone. It should be individual for each patient, for each person who have physical training. How about principles of exercise therapy, medical physical culture prescription? It's gradualness, emotional training individual, systematic character, control of effectiveness training. Did you remember for this we can use widely stress tests, functional tests for determination physical capacity of person before start training session and after some weeks and during current control pulse rate and blood pressure during physical training. Purposefulness must be concrete aims, purpose of training. Accelerated of the physical load, step by step. We must increase physical loading for patient for achieve the maximum therapeutic or rehabilitation or prophylactic effect. And sequence. How can dose of exercise therapy? Choice of initial position. Maybe you understand the lie down position will be the minimum dosage, sitting position more than in lie down position, and maximum in the standing position. Choice of rate and character load. Then more often load and use loading with resistant training, then maximum will be effect. Choice of type exercise. We discussed this. Choice of durations the training. The duration of training step by step also should increase for achieve the maximum effect from physical training for physical rehabilitation. Choice of movement amplitude. Choice of regimen. Rather of the tone up respiratory and special exercise. Emotional. You understand, if it's game, active games, as usually have a high emotional component, exertion, and opposite quite small active games have minimum emotional exertion. Compactness of procedure. How about prescription of intensity? Dear students, you can use this table for recommend adequate intensity physical training. Use heart rate parameters. Very light intensity when heart rate increase less than 30% from initial. Light less than 50% from 30 to 49% from initial. Moderate physical training when heart rate increase from 50 to 74% from different from initial heart rate. Heavy training when pulse rate increase from 75 to 84% from initial physical training, and very heavy when physical heart rate during physical training increase more than 85%. How about regimens of motor activity? In the rehabilitation, medical rehabilitation, there are some regime. First is strict bed regime. It's for patients with serious disease, for example, brain stroke, maybe seriously infarction myocardium. During strict bed regime, person must be all time in the bed, and toilet, nutrition should be in the bed, but during strict bed regime recommend exercise for small and middle muscle groups step by step increase intensity of physical exertion and involve large muscle groups. Half-bed regime, word, another name regime, when person can stand up from bed, come to the toilet, come for nutrition, can walk on the ward, can provide exercise for small, middle, and large muscle groups in the sitting position, standing position near bed, and lie down in the stand position. Free regime, when person can have can walk in the hospital, climb stairs, and have a more intensive regime of exercise therapy with use of special gym and other. In outpatient and polyclinic condition and sanatorium operates parent training and training regimes. This regime when person can have light, moderate and intensive physical training. It depends from a functional ability of patients. In this picture, in this table, you can see correlation between rehabilitation period, medical physical culture period, and regimes of movement activity. Main principle in application to medical physical culture exercise therapy. As early as possible and opportunity prescriptions of exercise therapy. This many scientific investigation proved. Then early start physical training, exercise therapy, better result of rehabilitation. Continuity in application APC in all stages of treatment. It's also, I think, understand. Maintains the main pedagogical didactic principles. We discussed this when study medical pedagogical observation. There should be medical control during provide exercise therapy. Combination of exercise therapy with other means of treatment. For example, electric treatment, heat cold therapy, and other. Correct combination of the movements and rest. Complex using the means and forms of medical physical cultures, exercise therapy. Principle on the construction of training. It should be active, clearness, accessible, awareness, consolidate of using skill. Guiding principles of administrating therapeutic exercise. Assessing the condition of the person, prevention, cure of rehabilitation. The exercise must be suitable, simple, and in the progressive order, simple to complex. Exercise should be done slowly and within possible range. There should be live demonstration or through pictures and charts. Importance of the exercise should be impressed upon the patients, written for prescription. Mental and emotional state should be considered. Incentive may be offered where necessary. Do not allow to substitute the muscle group. Variety of activities with different types of movements be given. Static type activities be avoided. Regularity in the exercise must be maintained. Main principle training, its systematic character, sequence, sufficient duration of the training, gradually accelerated the duration of training, little by little accelerated the physical load, individual approach in the training. Main rules implementation of medical physical culture. Dosage of the physical load, dispersion of the physical load in different muscle groups, alternations of the different physical exercise, periodical renovations of the physical exercise, emotional training to stimulate of interests, passage from simple to the complex exercise, maintenance of hygienic norm during training exercise therapy. In this picture you can see the different types of physical activity which we can recommend during exercise therapy for patient. You can see minimum should be inactivity time. Okay, dear students, massage. What is massage? It's a method of treatment and prophylaxis of the disease, representing set of the methods of mechanical dose out influence on the various sides of the surface of the person's body, the muscles, hands, or special device. Medical massage. Now, I won't say massage can be not only medical, that can be hygienic massage. Now, for healthy person, for prevention, different disease, can be sports massage for athletes, for improve stamina, improve physical capacity of athletes. Prevention sports trauma is used very widely. But we will study more detailedly medical massage, because we are physicians. Medical massage is a form of massage treatment designed to resolve medical conditions that diagnosed by a physician. It is performed in clinical or hospital settings and is given the licensed professionals who are trained to find and focus on problem areas. It is a therapeutical technique involving touch. In massage, a therapist works with the muscles and other soft tissues of the body in various ways so as benefit the recipient's overall wellness and health. Massage releases tension from the muscles, creates a sense of calm, and mitigates stress. Although massage has a particularly positive, powerful effect in the circulatory, lymphatic, nerves, and musculoskeletal system. Dear students, you can see in this picture different area for massage. It can be neck, lower head, shoulders, back, upper back, spine, lower back, hip, upper leg, thigh, lower leg, calf, feet, ankles, heel, upper lower arm, wrist, elbow, hands, fingers, and other. Use as usually 5 main methods of massage, technique of massage. First is gliding. It's superficial influence, mechanical influence on the skin in first of all. As usually in the classical massage provide direction of movements during gliding in the direction of veins, blood flow and lymph flow. the movements, it's superficial, prepare skin for more intensive massage technique. Next, it's rubbing. Dear students, all these techniques have many different variants that we can use different part of hands during different device, different part of body, and there are many thousand various variants. But all these variant of techniques divide can provide classification 5 main types. It's gliding cassette, rubbing, it's more intensive influence, mechanical influence on the skin. Also provide influence during this using with technique on the adipose tissue and vessels which have in this area. Next technique is needling. Its influence on the muscles. Next is vibration. It can be beating, clapping, and other. During this technique, create vibration in the tissues of body. And other technique, it's acupressure. During this technique, provide influence on the biological active points, reflexology. How about mechanism, therapeutic effect of massage, students? Here also in the fundamental lay down reflexes. For massage, it's cutaneovisceral reflexes. The stimulation different zone of skin, stimulate, improve blood circulation, lift circulation, different trophic process in the visceral organs and tissues in the place stimulations, but also reflectory in the organs connect with this zone of skin. This zone of Zaharian zone, if you remember from propedeutic of therapeutical disease, as usually same with zone of projection visceral organs on the human body and connect with dermatomes. In result this, also there are local effect that when in anti-oedemic effect, painkiller effect, can increase tonus of muscle or decrease tonus of muscles in the place where provide massage, and also improve nerve conduction, impulses in the nerves. Also there are neurohumoral effect. During massage produce some biological active points. It's endorphins, enkephalins, serotonin. If anybody had massage, remember about good mood, good emotion result of massage procedure. These biological active points can work as painkiller and also have antidepressant, anti-stress effects, and also anxiolytic effect have. It's reduced tension in the muscles, enhances circulation, relieves stress, stimulates movements in the lymphatic fluid, boosts immune function. This muscle pain improve sleep quality, improve joint mobility, speed healing of the soft tissue injuries, and improves mental conditional. Massage can use for treatment many diseases. Carpal tunnel syndromes, migraines, headache, pain association with pregnancy, range of motion issues, arthritis, back neck pain, muscle cramps, sports exercise injuries, work injuries, for treatment different therapeutical disease. When we will study physical treatment and rehabilitation patient with different disease, we will discuss this more detailedly. You can see there are different types of massage. That was deep tissue massage. You can see in this illustration. Myofascial release massage. Trigger point work. Also, there are contraindications to application of massage and exercise therapy. It's acute feverish conditions. It's more than 37.5 degree of Celsius. Acute inflammatory process, bleeding and inclination for them, blood disease, purulent process, disease of skin, nails of the infections, fungus on the obscure etiology, skin damage, thrombosis, thrombophlebitis, severe atherosclerosis peripheral vessels of extremities, obliterating endotheliitis with trophic disturbances, gangrene, aneurysm of vessels, inflammation of lymphatic vessels, the active form of tuberculosis, venereal disease, chronic osteomyelitis, benign and malignant tumor, excitation of significant changes of mental disease, thus psychosis. It's also contraindication for exercise therapy, contraindication of massage. Okay, dear student, thank you for attention. Goodbye, good luck.